So saliva ejectors, obviously in the saliva ejector market and aerosol, they don't go hand in hand. Saliva ejectors are designed for fluid removal inside a patient's mouth and make it much more convenient working with something that is able to access different directions and doesn't have too much power to suck your patient's cheek off or their tongue off. Saliva ejectors have a risk though. There's backflow. So whenever I close around the straw, 1 in 4 patients gets all the stuff going the wrong way, which is a huge risk with saliva ejectors. That's why there's all these little parts in here that should be cleaned, scrubbed, taken apart, disassembled, because of the risks associated with backflow. And we know it happens pretty common 1 in 4 times. So aerosol collection using a saliva ejector on a saliva ejector line, not the best idea because it's not going to be effective. Some of the new devices out there that work off saliva ejector lines, they're not going to be effective, unfortunately. So the CDC is saying, look at your HVE, use your HVE exclusively. So the downfalls of that is, most important, if you're using hygiene and an HVE, you're going to suck a lot more than you intended. So the straw is going to go in and unfortunately cheek, tongue, fluid, anything in its path, as we all know, is going to be sucked up. However, you're most likely going to have pretty good control over aerosol, not to mention patient discomfort. So you also have backflow risk, and yes, it happens in HVEs as well. So they work off the same suction line, just one's a little bit bigger than the other. So if someone closes around that huge HVE, there is always the risk of backflow. So you're seeing some new devices come into this market as well. And a lot of them require installation, cleaning. They can be challenging to connect tubings, etc. in that small workspace. So what we're trying to do at Dove is create a product that really fits into this space, works within this category. And we've already had HVE valves out there. So our HVE valves are disposable. One of the newest features that we have in all of our HVEs coming out very shortly, and in the new product that I'm going to show you, are Backflow Flaps. So we put them standard inside. You can probably see that. There's like a little haze inside there. So when air goes through, you can hear it pop open. When air goes the other way, nothing goes the wrong way. So it's a one-way little flap that pops open only when the air is going the right way. So we made them safe, disposable. No more do you have all these little parts and components that can get misplaced, clogged, and they require changing or lubrication. And then third, when you look at this market, it is the most effective for aerosol, but it's very inconvenient when it comes to patient access when you're using an HVE straw. So what we did is looked at the HVE market and used our HVE valve with a saliva ejector. Okay, so we're giving you HVE power. We're giving you a shorter access so we can be closer to the patient, because all studies, and ours as well, have shown you got to be close to the patient to collect aerosol. So we're still giving you that access. We're still giving you the ability to move around and maneuver. However, what's new on this product is a 360-degree around the tip of the valve, outside the patient's mouth, aerosol collection. Okay, so if my patient closes around here, I don't have backflow. If I'm working in the rear of the mouth, I still have, right at the patient's lip line, I still have aerosol collection. We know you got to be within roughly 2 inches to be effective. Uses HVE power, and it's always going to be clean for every patient. So you don't have to worry about cleaning it. You don't have to worry about scrubbing the parts. I pop on a new valve for each patient. I still have the same features, my on, my off. Again, patients can close safely. You're not going to have things going the wrong way. And then best of all, you don't have to clean anything, because these are real hard to clean over time. Whenever you've tried to clean one of these, you've probably noticed how challenging it is. And how are we packaging them? They look like this. So bags of 100. Your saliva ejectors are secured on the valves. They arrive clean. We make them in the USA. They will be fully stocked in the next week at the distribution centers. And cost-wise, you're looking at roughly about $2 a piece. Okay, so that includes the saliva ejector, the aerosol collection, and the full valve assembly. And they are not to be reused. They are fully disposable. And it's going to be the safest, most effective device out there that alleviates backflow. Any further questions, or if you want to try a sample, check out dovedentalproducts.com, and we'll be more than happy to send them out shortly. Have a great week.